Did you know that healthcare costs for individuals with disabilities are often 2 to 3 times higher than the average person? It's a reality that many people face, and yet it's often overlooked when it comes to managing finances. Welcome to Factful Finance, where we dive into strategies that can make a meaningful difference in your financial life. Today, we'll be tackling the crucial topic of managing healthcare costs with a disability. Before we dive in, a quick reminder. This content is for educational purposes only. While we may share useful tools or strategies, it's always wise to consult a professional to tailor advice specifically to your situation. Now let's talk about managing healthcare costs with a disability, a challenge that many people, unfortunately, face. From physical therapy to medical devices, the expenses can be overwhelming. But there are ways to stay on top of it, so let's break it down. First, let's address the key financial challenges. Healthcare for those with disabilities can include regular doctor visits, prescription medications, therapy, and sometimes long-term care. It can add up quickly, but the good news is that there are resources designed to help. Let's start with insurance. If you're eligible for Medicaid, make sure to maximize those benefits. Medicaid is often the go-to option for people with disabilities, covering a range of healthcare services. If you're unsure, reaching out to a health insurance navigator or a local organization can help clarify what's covered. Another major piece of the puzzle is the Supplemental Security Income (SSI) program, which provides financial assistance to those who qualify based on disability and income. Did you know that as of 2023, SSI offers a maximum monthly payment of around $914 for an individual? While it's not a lot, it can help with some basic healthcare needs, particularly when paired with Medicaid. Now, let's talk about some more proactive steps you can take to manage these expenses. Many people with disabilities rely on medical equipment or devices, which can be a substantial cost. For instance, wheelchairs, prosthetics, and hearing aids can easily run into thousands of dollars. But don't worry, there are options to reduce these costs. Check out Durable Medical Equipment, DME, coverage under Medicaid or Medicare. You might also qualify for assistance programs or discounts from manufacturers. Some nonprofits and foundations, like the National Foundation for Prosthetics and Orthotics, can provide financial aid or resources for those in need. But what about those everyday expenses that add up quickly? Well, budgeting can be a game changer. Just like you would manage any other area of your finances, taking a detailed look at your income and expenses helps identify areas to save. For example, Elijah, a viewer of ours, used a simple budgeting tool to track his monthly healthcare expenses. By being intentional, he managed to cut unnecessary costs, which allowed him to funnel that money into paying for essential treatments. Let's not forget about health savings accounts, HSAs. If you have a high-deductible health plan, HDHP, opening an HSA can be an incredibly effective strategy. The money you put in grows tax-free, and you can use it for medical expenses. It's a great way to prepare for unexpected healthcare costs, especially when dealing with a disability. Also, don't overlook community resources. Many local organizations offer financial aid or grants for medical needs that insurance won't cover. A little research can go a long way, whether it's local charities, foundations, or even crowdfunding platforms. These resources can provide some much-needed relief when you need it the most. Lastly, it's important to stay up to date on government programs and changes to healthcare policies. For example, the Affordable Care Act, ACA, has expanded Medicaid eligibility in many states, providing better access to healthcare for individuals with disabilities. Regularly reviewing your options ensures that you're taking advantage of everything available to you. We've covered a lot today, but here's the most important takeaway. Managing healthcare costs with a disability is challenging, but with the right resources, planning, and strategies, it's possible to ease that burden. Whether it's through insurance, government programs, budgeting, or community resources, there are pathways that can help. Now, here's a question for you. What's the first step you're going to take to manage your healthcare costs more effectively? Let us know in the comments. We'd love to hear from you. Thank you for joining us here at Factful Finance. If you found value in this video, why not hit that like button, subscribe, and click the bell so you don't miss out on future insights that can make a difference in your financial life. We think you'll enjoy the video shown on screen next. Stay tuned. Disclaimer: this video is for educational purposes only. For personalized advice, consult a professional financial planner or healthcare advisor.